Welcome to today's discussion about the COVID-19 crisis and its impact on the African American community. Leading today's discussion is Robert L. Woodson Sr., the founder and president of the Woodson Center in 1776, along with the Reverend Dr. DeForest Buster Soaries Jr., African American minister, author, and public advocate. They will be joined by panelists that have been assembled because of their background in servicing African American communities across the United States. Before we begin today's discussion, we will watch a previously recorded conversation between Robert Woodson and Reverend Buster Soaries. At the end of that recorded discussion, we will ask our panelists to share their individual experiences of the COVID-19 crisis in their communities, and we will then open up to questions from our viewers. Before we begin, we ask that you consider making a donation to help us advance the important work of 1776 by visiting www.1776unites.com. Please enjoy this video and remember to engage us at any time during the presentation via the live stream's chat window. Thank you for joining us.
I am Bob Woodson, the president and founder of the Woodson Center, a national nonprofit that I founded about 38 years ago. And our purpose is to assist low-income leaders in troubled, drug-infested neighborhoods to develop self-help strategies to restore themselves as well as their neighborhoods. We are here today to discuss and have a conversation about a critical issue facing the Black community today, and that is the spread of this pandemic and the disproportionate number of Blacks who are dying as a consequence of it. I'm joined this morning by my friend, Pastor Buster Soaries, pastor of the First Baptist Church of Lincoln Gardens in New Jersey, a longtime friend. Pastor Soaries, when I met him, spoke to millions of kids at Billy Graham's Youth Crusade for Christ, and he was speaking to millions of young people all over the nation and a leader among pastors. And I'm just pleased to engage in this conversation. I'd like to talk to you this morning, Buster, about the challenge that Black America faces in this pandemic. You know, and I know, that a disproportionate number of people dying as a consequence of this disease is in the Black community. And the question is, what is the response, or what should be the response? And what actions can be taken by officials and by the Black community itself to reduce this violence? I think you and I would agree that the real test of any policy or action should be what is the consequence for those suffering the problem. And so I would like for us to start with why the disparity, and what do you think we ought to be doing to address that disparity?
Well, Bob, thank you for not only having me today, but thank you for the work that you have done and continue to do to advocate on behalf of the least of God's children. Let me begin by simply stating what I did when the coronavirus began to spread. We began making plans at First Baptist to go from a live operation to a virtual operation. And what happened was the governor took a Thursday night in mid-March to declare that we had to stay home. And I was in Atlanta, so I didn't have time to really flesh out my plans. But the purpose of the planning was to protect people from each other, because it was clear then that this virus was spread from person to person. And the extent to which we were willing to isolate ourselves, practice social distancing, would be the extent to which we could flatten the curve and minimize the exposure of people to the virus. And so step number one was to practice social distancing. coupled with the other standard kinds of behaviors that we knew were mitigating factors for the spread of the virus. Wash your hands. Cover your face when you cough or sneeze. These were basic behavioral responses that came all the way from the Center for Disease Control. And when I announced it to my congregation, what I told them was that these hygienic kinds of principles were things that we should have been practicing all along. You know, I had a chairman of my trustee board at the church when I got there, who, when people prayed and held hands, he would never hold hands. Never. He was a tall, strapping guy, but he was a health teacher at a high school. He knew about hygiene. He knew about germs. And he would tell people all the time, I don't care what you think of me. I don't know where those hands have been, what's on those hands. I don't hold hands. Now, today, he seems more like a prophet than a mean old man. So we started with the behavioral response to the virus because I think all of the data reveal that it's our interaction with other people that increases the likelihood of us getting the virus. Of course, pre-existing health conditions, living in spaces where it's hard to socially distance, having other kinds of health disparities that are transgenerational, all of those are factors. But in my mind, and based on the research I had done, the best way to protect my congregation was to urge them, to beg them, wash their hands, cover their faces, and keep their distance.
I remember you sent a column to me, a news article rather, about what happened to a group of bishops that did not follow the protocols that you outlined here. And what was the consequence for those who did not do what you did?
Well, the great tragedy of this coronavirus was that the initial response of many African Americans was that we were immune. Somehow the rumor started that Black people could not get the virus. And so while other groups had already begun the process of social distancing, many African Americans of all backgrounds just ignored those criteria. And there's one denomination that had funerals for bishops, and numerous bishops showed up. In one case, I think it was 12 bishops showed up at the funeral, and within 2 weeks, 7 of those bishops had died, all African American.
So 7 of those had died.
Right. So I think this idea, whether it be religious or racial, that we can ignore the impact of our behavior on the spread of the virus is a bad idea. And I think if we don't emphasize that as the priority, it certainly is not the only, it's not the only way the virus needs to be addressed. Holistically, there are pre-virus issues, there are post-virus issues, there are any number of issues. But the easy way to promote safety and health during this season is to adhere to the standards that's good for everybody. You know, just the other day, Bob, I think I told you, the mayor of New York went with the police department to break up a funeral of a Hasidic rabbi in Brooklyn because hundreds of Hasidic Jews had gathered because of this esteemed rabbi's death, and the mayor and the police broke up the funeral. And the people were livid, but the mayor insisted that they adhere to the social distancing standards, and if it's good for the Hasidic Jews, it's got to be good for Black people.
Well, the question, though, is what you're saying is that the response to this virus, this pandemic, is twofold. One are external and the other is internal. The Center for Disease Control, in their original modeling, projected that 200,000 Americans would die. That was based upon a 50% of the public would comply with those individual actions that you just identified. But they were pleasantly surprised that 90% of the Americans complied, and as a consequence, the projected morbidity rates were dramatically reduced. In other words, it was individual behavior changed to take it to engage in all these safety actions, and that resulted in fewer deaths. But when the Surgeon General Jerome Adams made the same kind of proclamation or statement urging Black Americans to take the same self-protective actions, he was attacked. And the question is, why was he attacked when we're saying that if changing your behavior and engaging in the kind of actions you just outlined were important to reduce the deaths in the general population, the question is, why was this man attacked by people within the Black community who are so-called leaders or attacking this man, particularly people associated with the 1619 Project? What's going on here?
Yeah, well, Bob, I've given a lot of thought to this. We talk about it all the time. And, every week I look into the faces of my congregation, trying to figure out ways to communicate with balance. And here's what I mean. I believe that if the Surgeon General had been the Surgeon General in a Democratic administration and had said the exact same thing, I don't think he would have been attacked by the leadership class. And I think you have to distinguish between the leadership class in Black America and normal Black people, because normal Black people, even Black preachers on the ground, for instance, in Atlanta, in Chicago, Black preachers all across the country that I work with and preachers I don't know have emphasized the need to adhere to CDC standards. But to go back to my point, the first answer is we have become so hyper-political that Democrats, including Blacks, are going to find a way to disagree with Republicans, including Blacks, no matter what. And that's a serious problem. And it's much bigger than COVID-19. But our celebrity national leadership personalities are essentially extensions of the Democratic Party. And they play to the politics of the day. So that's number one. The second thing is this, Bob. I was 16 when Dr. King was killed, and I became an activist that day. So I've been an activist of some kind, whether it was in the pulpit, whether it was in government, or whether it was just in the community. And one of the unwritten rules, you know this because of your work as a civil rights leader yourself, one of the unwritten rules that emerged in the 60s was this idea that we would not criticize Blacks, that Blacks would not criticize Blacks in public. We used to call it airing our dirty laundry in public. The rationale being that when Black leadership or when Black media criticized Black behavior on any level, we were giving aid and comfort to racists. One of my old mentors said, you can't let white folks off the hook. Well, first of all, I've never seen white folks on the hook. That's number one. But here's the second thing is, today, with Jerry Springer having Black people on TV every day trying to prove the paternity of a child, with Facebook having Black people put all their business on social media, I believe this whole idea of not airing our dirty laundry in public is such an anachronism that it's almost silly, but it's embedded in our cultural DNA that if we describe the corruption of Black politicians who go to jail, if we point out the crimes committed by Blacks against Blacks, if we talk about the lack of commitment for Black men to raise their own children, we're described as blaming the victim, when in fact, there was a time prior to the mid-1900s when Black people, Black leadership thought and spoke and taught responsibility and excellence as being resistance and revolution. Listen, Rosa Parks became the symbol of the civil rights movement, not only because she sat down, but because she went to church. She was secretary of the NAACP. She was married. She was the moral leader of the community before she became the civil rights icon of the community. And so if you look back in the late 1800s, early 1900s, at black preachers preached against using alcohol, sleeping around, infidelity. That moral excellence has been our chief weapon for resisting white racism. But it shifted, the culture shifted, and now we find ourselves with this duplicity. On the one hand, we want the right to argue against the injustices of society, but we abdicate the responsibility to be right in our advocacy. And it's a moral dilemma among black people.
And this is why I think this conversation is important, because what we're trying to do at the Woodson Center is mobilize through our 1776, particularly black scholars and activists who are willing to stand up for those old traditions of personal responsibility within the black community. And I personally do not believe that bigotry is our biggest barrier today. I believe moral treason by those who are supposed to be our leaders is a bigger problem for us, because anytime anyone says, accuses someone of being insensitive to the black cause because they dare to say to people, you must change your behavior in order to combat this pandemic. In fact, what they're doing is saying that we have no right to challenge black America to change its ways. The very fact that in Atlanta, Georgia, 1,000 people met at a big block party, and in Chicago, Illinois, 150 young people had a block party. Blacks are having picnics where they're passing around marijuana cigarettes. All of this is occurring at a time of this pandemic. And those of us who speak out against this are somehow vilified as being blaming the victim. But what we're doing at the Woodson Center is reaching out to leaders like these pastors in Atlanta, grassroots leaders throughout the country. We want to convey a different message to black America that said your destiny is determined by your own actions, that you must be agents of your own uplift. If there's a disparity in the amount of deaths that are occurring, you have the ability to change it. And I think that some of the specific recommendations about solutions be well for us to discuss. One of the things that we can do, first of all, for every demand that comes in the form of a right, there should be a corresponding responsibility. You have a right to a decent education. You have a responsibility to study. You have a right to fair and good health care, but you have a responsibility to practice good health. And so I just think that what these preachers were recommending would be good for us to outline, that I happen to agree with. One of the things that I said, we should not be looking for the government or anyone to deliver us, that we should be our own PPD. And that if, rather than looking for the government for paycheck protection, perhaps we should identify a business that we frequent, that we can't any longer, and send that business a check in the amount that you would have spent if you'd gone there to get your nails done or get your hair cut. These are things that black America can do internally, regardless of what anybody does. And I think that what we want to create is the expectation that we will spend as much time talking about the challenges that we have within the black community to change our behavior regardless of what people do externally.
Yeah, I think it's unfortunately, it's being positioned, particularly through the media, as an either or, when in fact it's always a both and. What I like about you is that you've always given recognition to the challenges and historic barriers that black people have faced. It's no secret that banks participated in redlining. It's no secret that African Americans were slaves. It's no secret that segregated schools ended up offering inferior education. But it's also no secret that somehow blacks became homeowners despite redlining. And it's no secret that 8 to 12 blacks were born in slavery and died millionaires. And so I think what I respect about you is your commitment to telling the whole story. Because if you only talk about the barriers and don't talk about the successes and the solutions, you can raise an entire generation and impact an entire culture to feel that nothing is possible until everything changes. So what we have, both I'll call it left and right. You have left-leaning leadership that has a tendency to leave out personal responsibility as though it's not a factor at all. And then you have some conservative-leaning leaders who have a tendency to act as if slavery never happened and racism is not real. And so what we need is this balance, this kind of balance that you bring, the balance that you write about, the acknowledgement even in the Wall Street Journal that you give to barriers. The question is not whether or not there are barriers or problems. The question is not whether or not racism is alive and well. The question is, what is our therefore in response? And I focus on finance. That's been my kind of extracurricular activity. And when I have $125,000 wage earners who are living paycheck to paycheck, that's not an economic problem. That's a values problem. And the black middle class today is not threatened by wage disparities as much as we are the way we handle money. We don't save money. We spend money before we earn it. And I'm talking about the black middle class. And one of the reasons the black middle class is so marginal is because of the way we handle money. And so I think to ignore this is to do so at our peril. That every group has core principles that will make for their success, whether it's economics, whether it's health, whether it's education. I mean, Asians generally do better in academic subjects because they study more. They don't have a genetic predisposition towards intelligence. They study more. Asians watch less television. Asian children are required to do things. And so I just think you have to continue pressing forward. We have to continue making moral excellence the revolutionary tool that it always has been, and not be afraid to speak truth to power, even if the power is clustered within our own community.
Well, that's such a refreshing review of what enabled us to thrive in the past. And the challenge is, how do we apply these old values to a new vision? But we must have the courage, as you just said, to stand up against the naysayers. Because right now there's a dominant black elite class that tend to be left of center, who are doing something that I just think is most lethal in our current situation. And that is to say, nobody has a right to demand or to insist that Black America change its habits, not to congregate in large numbers, to separate. And there are those who are saying anyone who raises that kind of question is racist.
Yeah, until it comes to their own children. Like every other issue, I promise you, every celebrity leader that touts this blame the victim rhetoric, they will not let their personal children congregate in a barbershop for an after-hours party, go out without a mask or gloves. And it's that inconsistency that I think has to be pointed out. I want you to be assured, because I talked to pastors. I had a webinar earlier this year with 900 pastors. 48% of them are pastoring churches with less than 100 people. And I'm telling you, normal Black preachers, normal Black leaders normal block club associations and fraternity and sorority chapters, these people agree. You don't see them on national television. They don't show up on MSNBC. Even CNN and Fox don't interview these people. But I'm telling you that there is a leadership class of celebrity personalities that appear to speak for all black people, when in fact, history shows that when surveyed, black people lean more center-right than they do center-left.
Also, what they're doing, and that we are pushing against, Buster, is it provides an exemption for any personal responsibility. If you're congregating in the presence of a pandemic, it's not your fault. If you're not practicing social distance, it's not your fault. And if you are engaging in self-destructive behavior, it's not your fault. That until white people change, we cannot expect any change to occur in the black community. It's really, in one sense, an embrace of white supremacy to posture that the fate of black America, particularly those living in these communities that are fragile, that their fate is determined by externally what white people do or don't do, is really a fatalistic, dangerous reality. And that's why having this kind of conversation is very important to have. Because we need to give permission to people to be the kind of moral leaders that we used to be.
Yeah, that fatalism is certainly an implicit message that's baked into that narrative. But let me assure you of two things. Thing number one, again, is that the average African American understands the need to be responsible. That's number one. I absolutely believe that. I serve a congregation that's relatively large compared to most, and I can assure you that the average African American sees the both and. But I want to leave you with this sense of hope. Our core argument is that as pervasive and destructive as racism was and perhaps continues to be, it did not stop black people from owning businesses, from writing books, from building schools, and the like. So if you take that and fast forward to now, no matter how many Pulitzer Prizes go to people who, in our minds, have narrow views of our future, no matter how many celebrity speakers are on the news, like the racism that could not stop us from emerging as wholesome families and wholesome people, I want to argue that an extreme radical left-wing victimization philosophy can't stop us either.
No, and what we're doing at 1776 through our scholars is going back and retelling that history. The very fact that when white people were at their worst, when bigotry was enshrined in law, there were no blacks in political office. Back in 1929, in Bronzeville, Chicago, there were, in the black communities, 731 black-owned businesses with $100,000 in real estate assets owned by blacks in 1929, with only 15% of out-of-wedlock births, and that was considered a scandal. And what our scholars are telling us in 1776 by their research, you can go city after city after city, and you see evidence of economic growth and development. Durham, North Carolina, Greenwood section. We had our own railroad, we had our own hospitals, our own dental schools. There are contemporary examples of people who are applying these old values to a new vision. One of our scholars, Carol Swain, was born to 12 children, rural South, a dirt poor family, dropped out of school, had a baby early in life, eventually got her GED, and eventually her PhD, was on the faculty of a law school. She is a living example of, as she said, when she got to graduate school, that's when she realized she was oppressed. A young man by the name of LaShawn Samuels, a 19-year-old in Franklinton, Ohio, it's been reported that he was from a very troubled neighborhood. 3 friends were shot to death. He considered suicide at one point, but decided that he had to determine his own destiny. He walked 3 miles every day after school to a library to get mentored and doing his homework, and 3 miles back. And he kept up this attitude of self-determination, and as a consequence today, he's been offered admissions to 12 different colleges. And so there are all kinds of examples today how those values are still alive and well in places that would be otherwise seen as hopeless. And so there are other inspiring stories that we hope to highlight. Another issue dealing with money, we talk about income inequality. Well, wealth and financial well-being is never defined by how much money you make. The challenge is, how do you use that which we do have? And I know that the Woodson Center over the years has engaged in financial literacy to thousands of low-income people. But Pastor Soaries, you have taken financial literacy to another level, that it goes beyond just information. Would you explain what you do?
Sure, Bob. It started with what I did with my own life. I realized that the more money I made, the more money I spent, and the less money I saved. And so my own path to financial wellness started with taking control of the money I had. And so we started at our church, and now we've trained over 4,000 churches in a strategy we call D-Free, helping people change our attitudes towards money. That if we spend more than we make, if we owe more than we own, if our liabilities are greater than our assets, we're black, but we're not in the black, we're in the red. So what we start with helping people understand needs versus wants, helping understand priorities, helping understand more than financial literacy. Financial literacy says that you know how to balance a checkbook, you can answer the questions on a test correctly around money, but that does not impact behavior all the time. And so we believe that if people know better, they'll do better, and there are sufficient resources out there to help teach people, but it's motivating people to change our perspective. We are not what we own. Your significance doesn't come from what you wear. If you've got more money on your head than you have in your bank account, then you're in trouble. So that's what D-Free is. And we have data that shows this approach having longer-term impact than simply teaching people the facts about money.
So in other words, when you're talking about income inequality, it always addresses external. It does not deal with the internal.
Yeah,
and you mentioned something about athletes. If reparations, for instance, is another level, and you mentioned something about just having money does not create equality, and you gave some examples from professional athletes.
Yeah, the minimum wage in the National Basketball Association is over $500,000 a year. All you have to do is make the team, come to practice, sit on the bench. You'll make over $500,000 a year. The big players, of course, make much more. Within 3 years of retirement, 3 out of 5 NBA players filed bankruptcy because they didn't realize that if they make $500,000 but they spend $500,000 in one, they're broke. And so the emphasis on income is important, but more important is the emphasis on saving, on investing, on insurance, We've come to a point where it's normal in our community for GoFundMe to be our insurance policy, which is absurd. And so I think the issue of income disparity and wealth disparity has got to include, if not start with, an understanding of how we see ourselves and how we handle the resources that are in our hands.
Well, I want to thank you, Pastor Soaries, for joining me today in this conversation that I think is important, and that we want to share this with the country so that we can perhaps engage the kind of dialogue that we're having, that others will sit and have a similar dialogue. And I want to thank our audience for joining us, Bob Woodson at the Woodson Center, and we hope that you will agree to join in our future discussions on these very important topics. I want to thank the many people around the country who have joined us. I want to thank in particular some of our sponsors, Jim Forrest, Greg Kunis, and Freda Levy, who provide the resources that enable us to engage in this dialogue. We also want to take a shout out to some individuals, Ken Blackwell, former Secretary of State in the state of Ohio, and also Keiko James, the leader of the Heritage Foundation, and many others who have stood by us and supported us. But I also now want to introduce you to our panel who will engage in some discussion of what we've just heard. The Woodson Center has a network of 2,500 grassroots leaders in 39 states that are diligently serving their community with their actions to improve from within. Well, we've selected 5 of our local members from around the country to serve as a special panel to have some dialogue about what you've just heard. And after hearing from them, we want to open up and take questions from our live audience around the country, because we're anxious to involve you in what we're doing here. Because after all, remember, the goal of this is simple: to save lives. It is to save lives, to help people make better choices and protect themselves in the midst of this horrendous pandemic. I'd like to, for instance, go to, we have Pastor Willie Peterson, a longtime center friend from Youngstown, Ohio, Makita Hamer from Racine, Wisconsin, Professor Amira Friedman from Dallas, Texas, Pastor Darrell Webster from Indianapolis, Indiana, and Teresa Merriweather from Elyria, Ohio. I think I got that right. She just corrected me, and I appreciate that. And the question I would pose to our panel, just to start us off, is I don't quite understand why directing a message of self-determination and personal responsibility, why is it a controversy when the issue comes to the Black community? Why is it so controversial? Who would like to take that? Pastor Webster.
Well, thank you, Bob, first of all, you and Dr. Soaries for having this pertinent and relevant conversation as it relates to the problems in our community that we face daily. I think this is a conversation that is very necessary to talk about, and to not only talk about it, but also give strategy. One thing I do understand is that crises normally turn us inward. Sometimes we don't really think through where we really are until we face a crisis. And crisis makes us look at ourselves. It really separates the players from the pretenders. And so when you think about where we are now in this conversation that you and Dr. Soaries just had, real leaders normally give context and content during a crisis. The question you referred to as it relates to the pressure about the discussion of the behavior of our people, all through your conversation today, you and Dr. Soaries had one operative word, and that's behavior. You see, when we look within, what's in us come out of us. We can't give what we don't have. And normally during a crisis, what's in you normally comes out of you. And if value is in you, values are going to come out of you. In a crisis, your views may change, but your values don't change. And whatever you feel, that's what leads you. Now think about it. Conditions don't change us, decisions do.
Right.
We can't control conditions. We can't control the weather. We can't control the stock market crashing. But what we can control is our decisions about our conditions. I heard one of you guys say during this whole discussion that Black people's genius and creativity came out of them at the worst times in our lives. You think about it, at the worst time in our life, listen, Black HBCUs were built. At the worst time in our lives, credit unions were established in the church. And even during this pandemic, I believe that it still allows us an opportunity to seize the moment and see the moment and find strategies to grow through the moment. The reason why I like you and Dr. Soaries is because one of the things we can't do is react, but we have to be proactive. But however, what we're seeing now is the behavior that's in a whole lot of us as it relates to our community, because we can't give what we do not have. And
Teresa, Teresa made that same point, if I may, earlier on what you were saying, Pastor Webster. Teresa, would you want to share some of that with us?
Yes. Thank you for having me. I just spoke, about how with a background dealing with forensics, we look at things that can be admissible in court, right? So when we look at social media and things, you're seeing the evidence that people are throwing birthday parties for kids, and they're throwing barbecues and things. This is a very bad, big problem, because these children who you're throwing these birthdays parties to, and you're exposing them to COVID-19, they're our future. And so this is a very big, dilemma that we're facing. And looking back with Dr. Martin Luther King Jr., I look at how he educated the people. So we have to educate the people more on with COVID-19. We have to also empower the victims and the families that are affected by COVID-19 and come together to engineer a strategy on how to take on this whole thing. So that's what I have to say so far.
Good. Amira, what is happening in your city of Dallas about educating and outreach?
Well, there's quite a bit that's happening here in Dallas, since today is the first day that salons and barbershops are open. There is some awareness, but we still have to take it back to the question, to live or not to live. And it becomes a choice to keep yourself safe. And as you and Dr. Soaries highlighted in the video, we all need to take the virus seriously. And there's a lot of people that are not. And they're not willing to change their behaviors to keep themselves and their community safe. So I think that we have to be, as Pastor Webster said, proactive in changing those behaviors and getting what we need to keep our families, our communities, and ourselves safe.
And Nikita, what's going on in Racine, Wisconsin? I know you've been active in the community for many years, and you're seeing firsthand.
Hello, thank you. In Racine, specifically in the youth population here, I'm seeing an increase in the idle time and the stay-at-home order being taken as an opportunity to socialize more and be more creative in ways I can have fun and I can have my gratification satisfied, with youth going to different households. We're at late night parties instead of the clubs. We're finding out whose house we can go to where we can drink, and we're passing around liquor bottles. And again, the social distancing isn't being adhered to. It's not being taken seriously, the risk we're putting ourselves at. And it just ultimately boils down to a lack of knowledge that our people have in this community, where we don't understand why we're being told not to go anywhere. Certain precautions as far as just basic hygiene, where a lot of people wasn't following that initially, it's still not being taken seriously. And it's ultimately leading to, in the youth community, an increase in disturbances, nuisances in our neighborhood, where mom may still need to go to work because she's essential. And now I have to leave my household full of children at home, and they're unattended because they normally would be in school. The school district is trying to continue education via technology sources. But a lot of those families don't have the means to adhere to that. They may not have access to the technologies in their homes or access to internet. So it's especially challenging for the children who are already at risk, those who are already not attending school, not passing their classes. So now this is an even bigger barrier or gap that we're potentially posing, and it's not being taken seriously, where from their perspective, it's just, I got free time. I'm up all night, I sleep all day, and I get in a little trouble in the meantime.
I want to encourage our listening audience to raise your questions, that we want to hear from you in our chat line. Reverend Peterson, what is happening in Youngstown, Ohio? I know you and your church have done great outreach in the community. What are you all doing to take this message of personal responsibility to make it a serious factor in the community of Youngstown?
Again, Bob, I thank you very much for allowing me to be a part of this panel, and I thank you for the work that you're doing. I want to, in answering that, I want to piggyback off of what Dr. Webster and Teresa said. When he was talking about the way we grew up, the way things used to be, I not only look at the fact that we have a lack of knowledge, I like to say we have a lack of want to. I ask church members all the time, have your want to been changed? When I grew up, I look at the day when I grew up, the neighbors looked after one another. I would play ball in the street, and if my dad or mom went to work, my next door neighbor kept an eye on me. And I asked the question on a regular basis, am I my brother's keeper? Yes, I am. I'm responsible for the people, and especially as a leader, we're responsible to one another. And I think I mentioned it once before in a conversation. We can talk about, what we do and how we do it, but everything is permissible, but not everything is beneficial. I repeat that on a regular basis. Everything is permissible, but it's not edifying, and no one should seek his own good. So in Youngstown, what we see a lot of, there's an organization called SERVE, Community Initiative to Reduce Violence. And those organizations like that, and we partner with not only SERVE partners with all of the community organizations around the city. And they're doing things like stay at home, challenging, even when they're giving people opportunities to win $100 to participate even at home, tic-tac dance, not tic-tac-toe, but tic-tac dance, nonviolence giveaways. We're doing things in the city of Youngstown to give other opportunities or alternative, that's the word I want to use, alternative than allowing the young people to be stuck in the streets. In the Rockford area where I serve, my church is across the street from the community center that we serve. They're giving away lunches 2 times a week, not just lunches, 5 meals for each family, 2 times a week. So we're trying to do more to get the young people, get the people from just gathering 4 or 5 houses from my house. There's a set of young men that play basketball every single day. And no matter what we say, the question is, it's not a lack of knowledge, it's a lack of want to. And have your want to been changed? So we're trying to do what we can to help change the want to as it relates to the individuals in the community.
Pastor Webster, I know that you, Bob, I'm sorry, go ahead.
This is what we've just heard is what I refer to when I talk about normal Black people and local Black leaders. There is a substantial difference between the talking heads that the national media always goes to represent Black people and the people who are in the communities doing the work. And I want to commend you for spotlighting these people and there are thousands across the country who the media just will not cover. And the fact is, the average Black person, whether they're preachers, professors, community organizers, they want their community to be healthy, and they're engaged in stay-at-home strategies. You wouldn't know that by watching any of the major media, but it's a fact, and that fact has to be projected.
It really is, and as you pointed out, we at the Woodson Center have, as a part of our national network, about 2,000 grassroots leaders, of which the ones that you see are about a sampling. And so what we are trying to do is provide a forum for them to speak directly to themselves. I'm just amazed that Jerome Adams, the African American Surgeon General of the United States, has almost been silenced on the issue of personal responsibility. He said it one time and we haven't heard from him. And I'm hoping that he will be encouraged to know that there are thousands of people like the ones that we've assembled here today, just awaiting a message of personal responsibility. He should be willing to join with us in getting this message out. We cannot save. We must save ourselves in this environment. That's why this meeting was established, to get information, but also to inspire local leaders like yourself to go on and continue and expand. And this is why we are just excited about what we're seeing here. And I want us to go on.
Bob,
Pastor, go ahead,
Bob,
Willie.
You use a term on a regular basis. Your destiny is determined by our destiny, or your destiny is determined by your own actions. And that's what we're trying to let people know today, that in the communities where we serve, and all the individuals on the panel, and we've had people like yourself and Dr. Soaries as mentors for years, leading us and showing us ways to make a difference in our neighborhood. And that's really what we're trying to do.
Right. And so what we want to do is take some questions from the audience. And so I encourage those who are watching, whether on Facebook or what have you, to please give us your questions. We have some that I know that are coming in. One of the questions, Pastor Soaries, that we've received ask, what impact has the virus had on the way church services are conducted? You mentioned that some of the pastors died as a result of attending funerals. Perhaps you and Dr. Webster and others can comment on what impact has it had on your church. I know churches depend on income. Churches depend upon staffs. What impact has it had on the way you conduct your church service so that it's safe?
Yeah, I think the most painful part of this has been dealing with funerals. New Jersey, of course, is one of the hot spots around the country. We've had dozens of deaths. We have one death a day for the last month and a half. And not being able to gather and bring chicken to people's houses, I mean, that has been the most devastating effect. But in terms of our church operations, our staff is working remotely. All of our ministries are virtual, from our worship service to Bible study, prayer meeting, men's boot camp, Dr. Webster, all virtual. And I have to say that the encouraging aspect of that is people are participating. People are worshiping. People are praying. We're having our annual men's breakfast next Saturday morning virtually. People are giving. People are serving. We started with an Adopt a Senior program, and every week, every senior in our church gets 2 phone calls from one of their adopters. And so in many ways, the church has gotten stronger because Christianity didn't start out in big buildings with stained glass windows. Christianity started out in caves and homes. And so our church has been blessed. And what I've also seen around the country is that larger churches like Dr. Webster's and myself, and active churches like Dr. Peterson, I'm finding churches doing more to help other churches.
Absolutely.
And we've become more of a movement than denominations or mega churches or competitors with each other. So it's been, in that regard, it's been a very prosperous season for us. And I've seen Christianity in general blossom. You know, when people are wondering if the person next to them can breathe on them and kill them, they have a tendency to take God more seriously.
Absolutely.
Pastor Webster, I know that you operate in Indianapolis, Indiana, in one of the most dangerous zip codes in the city. You have not moved your church out of that community, but you have rebuilt your church in the middle of that community, and it serves as a beacon for the restoration of that community. I know perhaps you could share with some of the members listening in about your boot camp, and just how are you responding as in this environment?
Thank you, Bob. Great question. Yes, we still see several hundred men in boys boot camp, where we add value to men, to fathers, and particularly we equip and engage men and help them to work through complex issues. And what our boot camp men are doing right now, first I'll speak to that issue. We just opened a transitional house for inmates who are transitioning back into the community. And we are working through mentoring those fathers to reconnect them with their families. Our boot camp men are calling, we're in schools mentoring as we speak, but since schools are closed, we have a hotline where students can call. The boot camp men are actually also, Bob, delivering food to public housing so that the kids can actually get lunch. We have a campaign going on now that we're going to sponsor masks. So every kid in that community, that the school that we serve in, we're going to make masks for those families. But I want to also say, along with Dr. Soaries, we have a hotline, a crisis hotline now, where if you're dealing with grief, if you need counseling, you can call the church's hotline. And let me say this, we have not seen the major impacts of this pandemic, because the emotional and psychological impacts of this pandemic is going to go on for years. Right in the city of Indianapolis just this week, yesterday, less than 24 hours, we had a couple of police shootings. The weekend we had black on black shootings, and we're dealing with the social and emotional issues of this pandemic, but also we're dealing with what I said earlier. Crisis normally calls us to take a look within, and what's in us is coming out of us. So we're on the ground with boots on the ground trying to make impact.
This is a wonderful example of, I think, the potential of recruiting people to engage at a different level than what we're hearing on television. Again, I was amazed that we conclude this broadcast. I just want to reflect for a moment on in 2008, when the candidate Barack Obama was campaigning. He was speaking in Morehouse College, and he encouraged young Black men to take more responsibility for their lives and for the children they bring into the world. And he was attacked by the social justice warriors, the race grievance industry, as talking down to Black people. In fact, Reverend Jesse Jackson made a very vulgar reference in a form of a threat to him. And unfortunately, even though President Obama pledged to make that the centerpiece of his administration, it silenced him. And when Dr. Jerome Adams, who is the present Surgeon General, made the same point in a speech at the White House, again, he was attacked. And so it is. The reason that I believe that this broadcast is so important is because we cannot allow naysayers and people who is in the race grievance industry to silence dissent within the Black community. What has advanced the cause of Black America over the centuries has been the quality of the debate within as to the course going forward. And in the past 50 years, there has been no debate. And as a consequence, we are suffering as a result of that. So I really believe that sometimes telling the truth can be very inconvenient. There's a prayer that I utter every day: Lord, give me the strength to tell and pursue the truth, especially when it's inconvenient to me. And so I'm just pleased that I was able to join with my leaders from around the country to get this message out to the country, that it is important for us to tell the truth to one another, especially when it's inconvenient to us. Because it's unfortunately, you got to have courage to tell people the truth about what they're doing. The other message that I hope people took away from this, as I have, is that nobody will do more for you than you are willing to do for yourself. And that no matter what your external circumstances, whether it's a history of slavery, discrimination, or how you were born, or your unfortunate circumstance of your family, these are all external circumstances. When you cannot control your external circumstance, then you're only left with what your personal response is to them. As somebody said, the victimizer might have knocked you down, i.e. life and external, but the victim has to get up. If someone mugs you and you wait for them to come by and pick you up and nurse you back to health, you ought to be taken to a mental institution. And so the message of this broadcast is that Black America must take charge of itself. And there are people like you're witnessing here today that are indigenous to these communities. And the Woodson Center is really proud to have play a role in helping to reinforce and support grassroots initiative churches like Pastor Soaries, we could do a broadcast unto itself, because for the past 22 years, he has used his church as the beacon to revitalize his entire community as a hedge against gentrification. But that's going to be a subject of another time. But I think people are motivated when they see victories that are possible, not constantly reminded of injuries to be avoided. And the Woodson Center will always remain the place that you can turn to for solutions to problems. You can turn to for identification and support of indigenous leaders that will deliver us from this pandemic. We have been delivered from slavery. Black America is delivered from Jim Crow, and we will be delivered from this virus as well. But the destiny of our people is in our hands. And so I want to thank everybody around the country, our panelists, our supporters, our grassroots leaders who are the heart and soul of what I do personally and what the center stands for. But we want to thank you for participating, and you'll hear more in the future from 1776. We're going to rebuild our nation, but it's going to come from the inside out and the bottom up. Thank you, ladies and gentlemen, from around the country for joining us in this very important meeting today.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.